Hey there, everyone. This is Dale Hall, Managing Director of Research at the Society of Actuaries. COVID-19 has impacted current and future healthcare costs in a variety of ways, from the additional costs of having COVID be a diagnosis and treatment to the larger amount of costs that have been deferred, actually, because of the pandemic reducing traffic to local healthcare providers, or providers actually needing to focus on COVID-19 patients. And additionally, this changeover in behavior and methods in providing healthcare, such as an increase in telemedicine, but also a corresponding decrease in emergency room visits. So with all this in play, the Society of Actuaries developed the 2021 Healthcare Cost Model as a tool that actuaries can use to look at a variety of scenarios and determine the potential paths of emerging healthcare costs, not only through 2020, but also into 2021. And one of the main goals was to create this reference point where actuaries who were filing premium rates at state departments of insurance could use, and in turn have a conversation with actuaries at insurance departments to review these rate filings. So even as we head into the end of the year in 2020, I think the tool continues to have a lot of use for the profession. New waves of COVID are emerging, perhaps even stronger than what we saw in the early months of the disease. And it's helpful to see the impact on that as companies look to identify cost patterns for next year. So if you go to the SOA website and pull down on research and click on COVID-19, you'll see among the list of things this healthcare cost model. And you'll see on the landing page the spreadsheet model, which is the main tool that is there, but also a user guide, a user training video, a model documentation guide to lead you through the parameters in the model and how to use it, and then some reports looking at, for example, how healthcare has been deferred and restarted, some different ideas, different thoughts there. The model is able to capture healthcare costs in the future for many lines of business, both individually, ACA plans, small group, large group, Medicare Advantage, and Medicaid managed care plans. And it looks at a variety of cost categories: inpatient, outpatient, claims that costs that might happen at a physician's office, and actually pharmaceutical and drugs as well. You have some key inputs. You can input COVID cases and load them right down to a local level. You can see the infection rates in the population at that local level. And you can run a variety of future scenarios. One might be, let's pretend COVID never happened, and that would set a baseline for what future healthcare cost trend might be. And then you can choose a variety of different scenarios or create your own to see how healthcare patterns may play out, and you can see the deferral and recoupment of those costs as patients look to double back to any deferred care and providers look to absorb those deferred costs back into their provider routines. We have the output from the model showing in a variety of ways, both the actual cost per member. You can look at it monthly versus annually. You can also see some graphical displays to help visualize what the pattern would be for the forecast output. So I welcome you to take a look at the model, run some of these scenarios, get a sense of what may happen with current and future healthcare costs. Also give us your feedback. Just send us an email with your thoughts and comments to researchinsights@soa.org. So thanks for checking into this brief SOA Research Insight overview, and look for more of these to come through the research part of the website. Look for this at www.soa.org. For this Research Insight, I'm Dale Hall for the Society of Actuaries.